Now we're at 60. We were at 60 seconds, so y'all tell me when you're ready to.
Sam, the mics are hot.
Yeah, I can tell that. Oh no, I'm not supposed to be doing that too. Good afternoon, and I want to thank you all for coming out on this wet Friday the 13th. As you are aware, the World Health Organization has declared COVID-19 a pandemic, worldwide pandemic. An hour or so ago, Governor Abbott declared a declaration of state public health emergency, and President Trump is expected to make an announcement in a few minutes. Under Chapter 418 of the Texas Government Code, as county judge, chief elected official, and emergency management director of Tarrant County, I am declaring a local disaster due to public health emergency effective today, Friday, March the 13th, 2020. We have only, up until just a few minutes ago, we had only one presumptive positive case. We now have two. And so as such, what we're trying to do is to work diligently at staying ahead to contain COVID-19 within Tarrant County. I'm going to just tell you, I could not be prouder of the collaboration that we have had so far with our cities, with our schools, with our businesses, community partners, and our residents. It has been essential, or it is essential, that we as a community work tirelessly together to mitigate the potential and the risks of this virus. It will take our community to remain healthy and safe if we're going to do all this together. I want to read the declaration at this time. Whereas the World Health Organization has declared the coronavirus, now designated as COVID-19, as a global pandemic on March the 11th, 2020, and whereas COVID-19 was first detected in Wuhan, China on December 2019, and whereas the symptoms of COVID-19 can range from mild to severe illness and cause further complications, including death, and whereas on COVID-19 virus mainly spreads between people who are in close contact with one another through respiratory droplets produced when an infected person coughs or sneezes, and whereas the continued worldwide spread of COVID-19 presents an imminent threat of widespread illness which requires emergency action for the protection of the people of Tarrant County, and whereas the implementation of mitigation strategies can slow the transmission of the disease, and whereas this declaration activates the county's emergency management plan, and whereas the county judge of Tarrant County has determined that extraordinary measures must be taken to mitigate the effects of this public health emergency and to facilitate the efficient and rapid and cooperative response to the emergency. Therefore, be it proclaimed by the County Judge of Tarrant County that as a local state of disaster is hereby declared for Tarrant County pursuant to Section 418.108A of the Texas Government Code, the state of disaster shall continue for a period of not more than 7 days from the date of this declaration, unless continued or renewed by the Tarrant County Commissioners Court pursuant to Section 418.018B of the Government Code. This declaration of a local state of disaster shall be given prompt and general publicity and shall be filed promptly with the county clerk pursuant to Section 418-018B of the Government Code. This declaration of local state of disaster activities, the Fort Worth Tarrant County Plan of Emergency Plan pursuant to 418.018B of the Government Code. This declaration shall take effect immediately from and after its issuance, and I signed that order at 1:30 p.m. this afternoon, again on March the 13th, 2020. Before I call up our Health Director, Dr. Tanasia, and our Public Health Authority, Dr. Colquitt, our public health officials, to discuss the guidelines and to answer some of the questions, I want to specifically talk a little bit about the large gatherings. Tarrant County is recommending that events over 250 people be canceled. Additionally, we strongly recommend that organizers of events of any size in which people will be in close contact with one another be canceled or postponed, if possible. If you cannot avoid bringing people together, then what we're going to recommend is the following guidelines. Anyone who is sick or has a member of their household who is sick should not attend. Those of high risk should not attend. We're going to increase the frequency of sanitizing common touch points. Try to encourage the attendees to stay at least 6 feet away from each other. Socialized distancing is one of the things that we're calling that. Keep an adequate supply of hand soap, disinfectants, tissues, and paper towels around. Encourage attendees to follow the increased hygiene things that we have already been suggesting. Wash hands often with soap and warm water for at least 20 seconds. If soap is not available, attendees should use an alcohol-based hand sanitizer with at least 60% alcohol. Avoid close contact with other people. Avoid touching your eyes, your nose, your mouth. Cough or sneeze with a tissue, or again, if you can't, use the sleeve to do this. Avoid physical contact. Now I would like to turn this over to our Tarrant County Public Health Director, Dr. Tanasia, and our Tarrant County Health Authority, Dr. Colquitt. Thank you.
Thank you, Your Honor. Good afternoon, everybody. I'm Vinny Tanasia, Director of Public Health for Tarrant County. And first of all, I wanted to address that we do have a second presumptive positive case. A person is a traveler from overseas and tested positive today at our lab. Now, we have our first case and a second case, two unrelated situations. But what we're here to talk about today are public health recommendations, and I want to sort of back up and tell you why we chose today to do this. And the reason is we've been watching the situation unfold across the world for a while, and now in the United States. And we're starting to see rapid expansion in number of cases across the United States, with multiple states starting to show local transmission chains. In the state of Texas, first local transmission was identified in the Houston area, I believe in Montgomery County. And then late last night, Dallas County announced that they had 5 new cases, one of them being localized transmission. So in the combined community of Dallas-Fort Worth, this is a major trigger event. So we are now trying to make some recommendations that we want the public to take seriously and follow, because this will help us get ahead of the curve and try to slow down the rise of this virus in our community. If we don't, then the chances are that we will start to see some increase in numbers. With that said, I'm going to go over some very high-level highlights of our recommendations, and the document will be posted on our website on coronavirus.tarrantcounty.com, fairly quick here. But as the judge was saying, first and foremost, we want to address the large events and large gatherings. Anybody who's holding an event of over 250 individuals needs to cancel that effective today. And then any events under 250, we strongly encourage that you make the judicious decision, whatever's good for your event and your community. If people have to come together, then practice social distancing. And I will just highlight one thing. Ideal distance between people is 6 feet for this disease. Recommendations for workplaces and businesses. We're asking employers to activate their continuity of operations plans and execute them now. And usually in those plans, what they have is ability to work from home, go to shift-based work, and try to accommodate people and be flexible with the hours so less number of people have to accommodate or aggregate together to do the work. Spread it out throughout the day in multiple shifts. Recommendations for schools. We are recommending all schools to extend their spring break in Tarrant County, starting at the last day when their scheduled spring break was supposed to end, for 14 days. And the reason for that decision is we're expecting a lot of families who have been traveling either in the United States or overseas to return to our community, and we want them to stay isolated at home and go through this incubation period for the disease for 14 days to see what develops, instead of those children coming to school and possibly having an issue there. We will be working with the schools to evaluate the situation further as we get near to that 14-day time period. Recommendations for freestanding daycare facilities. To mitigate the impact of our recommendations on our community, because it does stress out the community with lots of changes happening, we are allowing our freestanding daycare facilities to stay open at this time, but we're putting a lot of procedures in place for them to follow, and those can be found on our website. The key would be to restrict visitors and, of course, practice social distancing. Recommendations for senior living and assisted facilities. Effective today, we want them all to start restricting visitors from the outside and cancel any social events they might be having within their own facilities. Again, further details are available on our website. Recommendations for people at higher risk for severe COVID-19 illness. And I want to sort of talk about that group because that's our biggest concern. People over 60 and older, people with underlying health conditions, and there's several, but major one being heart disease, lung disease, diabetes, and so on and so forth. People with weakened immune systems, pregnant women, they should avoid large gatherings of any kind. In short terms, hunker down at home and let this thing pass over if possible. We understand that's very difficult to do, but try the best you can. Mental health resources, information is available on our website to fight any fear and anxiety issues that the public may experience. And we want you to learn about the disease, because the best way to fight fear is with fact. And once you learn that, you will understand how we can fight this disease with social distancing and good public health practices. Recommendations for people who are sick. We really want you to practice prudent approaches to this. At home, you will not know whether you have COVID-19. What I also want to address is right now we're still at the peak of our flu season. So if you're experiencing flu-like symptoms, don't jump to the conclusion that you have COVID-19. I want to reassure you, most people will probably just test positive for the flu or the common cold. But we are expecting cases to rise in our community, so be prepared for that. So stay home when you're sick. Don't go out in the public when you're sick. If you're ill in any way, call your doctor's office first before going in and give them a heads up, because we don't want you to be waiting around in a waiting room. We want you to wear a mask at the doctor's office, and they'll take you into a room, do the workup, and do what are the necessary steps to get you tested. And then, if you're not seriously ill, where you don't have shortness of breath or any other life-threatening symptoms, don't just go to an emergency room, because that is going to just flood our healthcare system. And also, you are probably going to be at the risk of catching a variety of illnesses, because seriously ill people do go to emergency rooms. So if you're mildly ill, go to a walk-up minute clinic or an urgent care or your primary care provider. And if things don't resolve and you get seriously ill, that's when you go to an ER. And then, of course, if you have symptoms like cough, fever, or other respiratory problems, stay at home and isolate even from family members because you don't want to make them ill. Recommendations for the general public, a lot of those our county judge has gone over. Again, good social hygiene practices, washing your hands throughout the day, covering your cough and sneeze in your sleeve, and staying home when you're sick. But one particular thing I want to address, recommendations for travel. At this time, Tarrant County Public Health recommends that all non-essential travel be canceled. And what that means is we want to try to mitigate our people trying to go across all over the country or in other parts of the world and coming back to us with potentially carrying this COVID-19 illness. So anything that's absolutely urgent, we understand that you have to do, but if it is non-essential travel, leisure travel, please stay at home, stay within our community, and stay healthy. With that, I'll turn it over to our medical director and local health authority, Dr. Catherine Colquitt, who will go over some of the details of the virus and how it spreads and how do we fight this disease.
Oh, thank you and good afternoon. This is a novel coronavirus. We have a lot of coronaviruses that humans have been exposed to over time, but this is a new one that first appeared in an open, mostly meat and fish market in a place called Wuhan City in Hubei province in China. And it's clearly capable of spreading very fast around the world. Since it emerged and was recognized, it's now present in over 100 countries. We know that it spreads by droplets, but it does seem that some of those droplets stay in the air for a little bit longer than we're familiar with most other respiratory viruses floating in air. The reasons for the measures that we are instituting today are that we don't have any treatment. If you go to an emergency room and you have flu, you'll probably get a prescription. If you're very sick in the hospital, you might get IV medicine. We don't have any medicines for this virus yet. They're in development, and we have a vaccine that's already being trialed in humans, but it isn't available for widespread use yet. And it takes a little while for that vaccine production, once a vaccine is improved and proved to be safe, to get up and running so it can be distributed worldwide. And with over 100 countries, everybody is going to want this vaccine. So the measures that we use to try to control coronaviruses and other respiratory viruses, because it is one of many, are things that you all already probably know how to do. There are things like cough hygiene, meaning you cough into your sleeve or you cover your cough. You hand wash or use hand sanitizer if soap and water aren't available. And probably most importantly, you stay home if you're sick. You don't play the hero and come to work. If you're sick, please stay home. If you're very sick, you should go to a hospital. If you're mildly ill, you can stay home and just maybe telemedicine with your doctor or his or her office. But please don't come to work or go out if you are ill. Our 2 cases in Tarrant County are all travel associated. The other reason for the institution of these measures is because we don't have any spread within the community yet. There are other communities in Texas, as Vinny referenced, who have had community spread, meaning people have gotten sick with the virus and have been recognized to have it, who have no other exposure. Usually the guidance has changed a lot because this is an evolving understanding of this new pathogen for us, and it has people somewhat frightened. The general public's sort of nervous. But in thinking about people's risk for coronavirus, you're thinking about people who have traveled to countries where there's widespread disease with this virus, people who have taken care of or been in very close contact with a case, and now the guidance has expanded to people who have a fever and a serious respiratory illness, typically a lower respiratory illness with cough and shortness of breath. We are very much aware that our healthcare partners have processed this guidance, and they are starting to screen. The good news is our lab at Tarrant County, it's a North Texas Regional Lab, it's a laboratory response network lab, has been testing for a little bit over a week, and we've noticed that the pace of demand for testing has increased quite steadily because the number of cases in the U.S. and the concern about this has also increased a lot over the last few days. For example, yesterday there were around 1,250 cases that we knew about in the U.S., and today there were over 1,600, close to 1,700. So the numbers are going up, and we want to try to intercept as much as we can the introduction of virus into our community. We'd like to keep it from spreading here. That's why we're doing the things that we're doing. So. Thanks.
Once again, I really want to thank Dr. Tanage and Dr. Colquitt. They have been working very hard on this for several weeks. We've been having calls getting prepared for this day. We had hoped it wouldn't come, but we really felt like that this is the best course of action to take at this point. Again, we are trying to get out in front of it and not get behind and have to try to catch up. And I think that's very key, and I really want to thank the collaboration that we've had with our local partners, with our cities, with our schools, with our businesses. I cannot thank Fort Worth, Arlington, Mansfield. Those elected officials and those staffs have had to make some tough decisions on some major events over the last couple of days, and they have all stepped up and did not require any, okay, you really need to do this. They were right there ready to volunteer and ready to get it done. And I think that's what it's going to take if we're going to keep our community safe and hopefully try to stay ahead of this. Again, one of the things that I want to just stress again is how important it is to remember the guidelines that we've discussed. Stay at home as much as possible, especially if you have a fever or if you're sick. If you do go out, practice the social distancing. I try to encourage everybody, you're supposed to stay 6 feet apart. That sometimes may be difficult, but at least stay and try to separate the distance. No physical contact. I've seen even the bumping. No physical contact if you can avoid that. So much of what we do is a habit that we have developed over years. I know earlier, every time I went up here to move a page, I thought, okay, here we go. But it's just one of those things, sometimes you have to just really try to avoid doing those things which have become a habit. We're really doing all of this to protect those folks that are most vulnerable to that in our community. Our older adults, our individuals with chronic illnesses, pregnant women, and our children. It's very important that we take this very seriously. And I know that you will, and I appreciate very much all of your help and participation in trying to make these things happen so that we can stay ahead of it and that we don't fall behind it. Now, at this time, we're going to take questions, and I'm going to kind of get out of the way because I have a feeling that the questions are going to be for these folks behind me. Go ahead.
Yes, Eric Alvarez, WFA. For Dr. Taser, you mentioned the second confirmed case in Tarrant County with traveler from overseas. Can you elaborate on where that individual came from and is that individual currently under observation here?
Yes, the person is in Tarrant County under observation, and the person is a traveler from overseas. I don't have the details available at this time. No, unfortunately, we're bound by HIPAA, and we are going to set a stance here that we're going to release very limited information. Only thing we're okay to release is if there was any travel, or if that person is, Tarrant County resident, or came from overseas, things like that, and how many number of cases. I know there's been a lot of questions about age, what city. We've had our HIPAA compliance officer look through all of that, and a guidance has been issued from the federal government about what is okay to release during a major outbreak, and unfortunately, the individual HIPAA laws still apply. So we're going to continue to toe the line that absolute minimum information that's needed for the benefit of the public is going to be released.
Can you tell us how many people have been tested in Tarrant County?
I don't have the number handy, but I know that we started testing about a week ago, and the lab is now starting to see an increase in number of tests that they're running. So as more and more people become aware, and as people are symptomatic with a variety of illnesses, doctors are qualified them for testing. So the lab is getting fairly busy, but I don't have a number handy. And part of the reason is the number is usually not useful because our lab is the lab for 33 counties. So a lot of the testing is coming from other communities as well. So I don't want you to start drawing conclusions on how many tests are running and what that means for our community, because Tarrant County's numbers may not be there. Yes.
One, I would ask that you repeat the questions because they're not from out there. The one thing that I would add with regards to the folks that we're monitoring, we have basically flagged those households on our 911, on our first responders, so that if a first responder is called out to that particular address, they will know that that there's someone within that household that we're monitoring or we're testing. So while we might all like to know, we don't need to know. Our first responders do, and they will know that when they're called out.
And thank you, Judge, for that, because that is an important point of clarification and reassurance to our community that people who need to know, see, that's the basis of all of this. People who need to know are in the know. And the same compliance officer who told us that we can't release information publicly is the one who led the charge of making this system work. So what we are doing is that people who are under monitoring, or if people are at home isolation after they've been tested positive, all of those addresses are being given to respective city trusted points of contact who secure that information and put in the computer-aided dispatch system. The idea being at any given time an emergency call could come from that address, whether it's a fire, police, or EMS call, and they get a pop-up alert. This address, please call Tarrant County Public Health at a 24/7 number, and it's only for their use, and then they get appropriate information on that situation, whether they're going into a harm's way from a disease standpoint. And if it is, then they wear appropriate PPE, personal protective equipment, like masks, gowns, gloves. So that system is in place and has been in place for almost 5 years. And we've tested it and lived through it with a variety of diseases.
Can we get some more information? I believe it was said that it appears the virus is present in the air longer than previous illnesses. Can you clarify that, please?
Very preliminary. And,
Please repeat.
oh, I'm sorry. Please repeat the question.
No, you repeat.
Oh, so the question is does the virus live in aerosols for longer than we're typically seeing with other respiratory viruses? And the answer is in some aerosolization experiments where people take a viral culture and put it in basically the reservoir for something like a nebulizer. Some droplets that contain virus seem to float around for a little bit longer. Normally with things like flu virus, it's minutes. But with this, it might be a couple of hours. And that is extremely preliminary data. But it's one of the reasons for attaching some extra significance to this virus and the importance of controlling it. Thank you.
Judge, in terms of urging the school districts to extend spring break, is there any coordination going on between the county and school districts in terms of families who may find hardship with keeping kids at home for this extended period of time?
The question was with regards to the schools. Is there coordination between the ISDs and the county regarding some of the hardships that are going to be encountered by families with regards to meals as well as childcare? Again, we've been talking with the childcare facilities, and we're expecting that they're going to remain open, and we've given them certain guidelines that we hope that they'll be able to follow. With regards to the meals, we talked about that on a call with the superintendents. So we have asked them to look at their plans, same plans that they may have in place for the summer, and then that we will get back and have other calls on how we might do it. One suggestion that was after that particular call was we have bus routes. We have bus drivers who are going around, so we might very well at least explore the possibility of putting the meals on the buses, let the driver drive the route and be able to do that. So that's one idea, and I think that was a very good idea, and we're going to explore that with several of our school districts.
Last week, I think you guys had a press release that said that the capacity for testing would be 50 to 100 by the end of this week. Is that true? And I know the governor said yesterday that 10 labs would have the capacity for 125 tests.
Right. Thank you. So the question was, what is our lab testing capacity and has it been ramped up? We're in the process of ramping that up. Current testing capability per run during a day, I think it maxes out at about 24. And we're, estimating that we'd probably have to start running more runs in a day. The reason for this low capacity is that we have to do manual extraction of the viral samples right now. And we have automated extractors available that have been installed at our location. Staff are being trained on how to use those, and we're waiting on some reagents to arrive. Once all of that is taken care of, the testing capacity will ramp up to anywhere between 50 to 100 a day. We hope we don't have to use it. And also, I wanted to stress this point because when the public hears that public health lab is doing the testing, they like to walk into our public health clinic and say, I need to be tested for COVID-19. That is not how this works. Public health labs are generally either surveillance labs or in a pinch situation like this where nobody else has it, we start the things going, right? We'll get you some tests available in the community. Really, the load of this is going to be picked up our commercial labs because they have huge networks of labs. So what I understand is LabCorp, Quest, and Arup labs are now online. So doctors and hospitals have access to these labs. So a lot of the testing is starting to go that way. And the need for public health labs to continue to do this work is going to be very limited. So I just want to make sure people understand, do not walk into your local health department asking for a test. If you really think you have COVID-19, go talk to your own healthcare provider, and they will work through why you think you have COVID-19. And if you qualify, they'll ask for a test from an appropriate lab, including ours.
Let me also say with regards to that the health department will have on their website checklists. And this will be something that, so as an employer, if you have someone who's been out and they're coming back, once the schools get to the point of reopening, in other places, checklists of questions to ask so that you can begin to say, okay, maybe we have a problem here, maybe we have an issue here. And those will be checklists that will be available on our website, on the public health website later today. I can't encourage you enough to go to the websites of the various entities. Everybody's looking at it from their particular perspective and are looking at what they can do, again, to help keep our community safe.
Specifically, what would you suggest for churches and houses?
So again, if there are gatherings less than 250, then we strongly encourage that they either think about canceling, or if it's possible, then go televised or live stream on their website. The idea is less number of people that come together, the better it is. But if it can't be canceled for whatever reason, then what we've been asking businesses to do, churches and other houses of worship can do the same thing. Go to multiple shifts, if you will. Do it multiple times during the day. Do the service multiple times in a day so people can spread out. Again, ideal distance is 6 feet between people. Also, in a lot of religious practices, they're sharing of food and drink. Let's not do that. Let's not shake hands and hug and kiss each other. Maintain your distance. And we will leave it up to their individual leaders to decide how best to implement our recommendations. But again, if it's over 250, we're recommending cancellation. Under 250, we're strongly encouraging leveraging of technology to do this work. We obviously want people to worship and have the chance to be in their faith in this tough time, but we also want to make sure they're healthy and safe.
Are there plans for the county courthouses and
The question was about other plans within the county. We have had various meetings with various groups. I know that our county clerk is in the back. She is going to be closing the passport offices for the next week, for at least the next week up until March the 20th, and then we'll reevaluate and talk with her about that. I know the judges have been meeting with regards to how the various courthouses will function over the next couple of weeks, and there should be a statement out about that fairly soon. I don't believe we've put that on the internet as of yet. Okay, so that will be coming out probably a little bit later on this afternoon. But other than that, the county is going to remain open. We're going to be here to serve the people and to help in any way we can as, again, we look to move through this deal.
one more thing? I just saw a report that flights were being diverted to a limited number of international airports, and DFW is one of those. So I didn't know if you guys have been involved in conversations about that and what the risk is that incoming flights might bring more of the virus here.
Right. So the question was about flights being diverted to 11 funnel airports. I believe it's still 11, right? So that was a decision that was made a while back. I think Super Bowl Sunday, if I remember correctly, there was a decision to expand from 5 airports to 11 funneling airports. The idea being, let's not spread the issue of people coming from overseas to multiple airport locations across the country. Let's pick some large metro areas that have the capacity to handle this, and then funnel all people through there. So that does increase the I guess the burden in our communities of having people come through the airports. Now the expansion of the travel bans has been an issue. So first we had China, and then we had Iran, and I believe now there's Europe. So what that does mean is that our local health departments are going to be monitoring more and more people as these countries are now on a restriction list, and people are probably coming back to leave that country if they were visiting and come back home. That's fine, but we're going to work with them like we've been working with the others, that you're going to be self-isolating for 14 days. We're going to be monitoring you for symptoms. We're going to be educating them on what to watch for, and then they'll be reporting that to us. If they start to have symptoms, especially if they come from a high-risk country like Italy and Europe or many other countries that are experiencing an outbreak, of course, we'll go through the process of working with their healthcare professional and asking them to get a test. And if they test positive, do all the necessary containment measures that we do around a single case. And then, of course, continue into our community mitigation strategies, so we're using both at the same time to slow the spread of the disease.
Is there any plan to test for community spread, or what does that look like?
Yes, that's happening now, and that's how we've found community spread in Dallas, and I speak for the local health departments, our brother and sister in local public health. That is happening now. And all across U.S., you're going to find that there are health departments testing for community spread, and once we identify that, and we did in our DFW community, that becomes a local trigger for action.
When it comes to the recommendation of school breaks being extended an extra 2 weeks, is there any sort of resource for parents perhaps who may be struggling with childcare or whose kids are on free or reduced lunch? Where do they go? What do they do?
Right. So a lot of those discussions are happening with our schools, and a lot of those wraparound services are being discussed. But this was a consideration on why we let the freestanding child care stay open for now, with some strict guidance on what they need to do for children who are being dropped off every day and picked up, restrictions on visitors, and so forth. Details are available on our website. Again, the idea is to mitigate the pressure that this brings onto our community, especially related to child care. Okay, thank you.
Oh, yeah, I'm going to ask Dr. Colquitt to talk a little bit about what we do. The question was about the community spread and how we're looking for that. So I wanted to ask her to speak a little bit to the issue of once we identify somebody, what happens after that?
So we don't test people that are just under monitoring because they have a risk factor. But in our cases, we have had 2 so far. We investigate them the way we investigate any other concern of our general public health, by talking to them about their contacts, where they've been, who did they spend a lot of time with, when the symptom onset began, and what their vaccination status is. We do that for all kinds of communicable diseases, not just for this one. But our epidemiology department is extremely good at doing contact investigations. So we're pretty dogged about that. Thank you.
No cure out there. What is the initial treatment?
The initial treatment is totally supportive. If it's a mild disease, then you stay home and you rest, you drink plenty of fluids, you treat your temperature with Tylenol or ibuprofen if you need to. If you're seriously ill, you go to a hospital and get the level of support that this serious illness requires. A lot of times that level of support is kind of determined by other things that are wrong with you. If you have heart disease, if you have underlying lung disease, if there's something wrong with your immune system, as Vinny alluded to, if you're pregnant, those are all things that can make it more complicated for you. There is a single compassionate use drug out now for this disease. You have to be very ill to get it, and you have to petition the drug company for it with help from the CDC. There will be treatment for this disease, but there isn't readily available treatment now. Nothing you could use in an outpatient setting. Okay.
Any other questions? We have had the question come up a number of times that if you don't have insurance, what do you do about if you think you need to be tested? Again, in those situations, I would attempt to go to an urgent care, a minute clinic. A lot of direction is coming down both from the federal and state regarding waiving copays and things along that type lines, or the U.S. government is trying to say just waive the cost of the test. Another alternative would be to go to our safety net hospital. That's JPS. I know they're going to love me for that. But also the clinics that they have set up. Again, walk in, and I know that they're already doing screening at their facilities, but the one thing I would say to anyone who is walking into a healthcare provider, as was mentioned earlier, be sure and alert them as to why you're there. Don't sit in with the public, because if you're not sick, in all likelihood you may end up sick, and certainly if you were to end up having the COVID-19 virus, we don't want you contacting all of those folks, and then Dr. Colquitt will have to go out and interview everybody that was in the waiting room. So let's just use common sense. and let's do what we, all that we can do to help the people in Tarrant County and to try to stay as far ahead of this as that we can. And I know working together that will make a difference. Any other questions at this time?
Judge, can I make a quick comment?
Sure.
In closing. Again, I know we've covered a lot of information. A lot of information is coming our way, and things are happening. But what I want to end with is that I want to reassure everybody in our community this was part of our plan. We expected these things to occur. That's why when a community trigger occurred, here we are the very next day taking all the necessary action that our community needs to take with the backing of our leadership. This is, a serious matter, but we will get through this. We've gone through many situations, 2009 H1N1, before that there was SARS, monkeypox. Our country has dealt with a lot. We dealt with many, many other scenarios, West Nile, Zika. This is no different. This is another disease. We will fight it off. All I'm asking is your cooperation and your understanding that these measures were necessary to protect the health of our community. Let's not fear this disease. Let's learn about it, and we can win. Thank you.
Thank you all very much. Good job.